Good day, I am Dr. MC Mativa. I am going to demonstrate the single cone obturation technique. If we were to look into this block, we're going to assume that we've done our shaping, we've performed our final rinse protocol, right? Now, the next thing to do would be then to dry our canal using pre-measured GP points, okay? Not GP points, but paper points, making sure those paper points go directly to length until that canal is nice and dry, okay? Now, once we are happy that our canal is nice and dry, we are going to introduce our bioceramic sealer, which is what I love to use most of the time. In my most cases, I use my bioceramic sealer. There we are. I'm happy with the canal. Now the canal is nice and dry. The next thing to do will be to pick up our bioceramic sealer, okay? I'm going to hide the name, but I use this. I love these ones with which come as a syringe, because all you do is to introduce the cannula of that bioceramic sealer as far down as you can. Then, without wasting time, you just deposit your sealer, and then what you do is that you continue to deposit it. As you can see, the sealer will continue to walk down the canal, and you'll also get what we call backflow. Now, with that, now we can observe and appreciate the amount of sealer in the canal. That is quite sufficient for this situation. Now, the next thing to do will then be to use or to pick up our master GP. And without wasting time, we just push this on a single motion. Push this master GP down to length, and we have to push it as far as we can and tight as possible. Right, single movement, just like that, is more than enough. We don't need to exert any lateral movements and whatnot. No, we are happy with that. So, with our GP now sitting in position, we have to cut this GP at the level of the CEJ or the level of the orifice. Now, what I'm using here, it's a GP cutter, right? I love this instrument, quite neat to work with. So, you have to cut the GP at the level of the orifice or at the level of the CEJ, and just like that, in one single motion, voila, and the GP is out. Our GP is cut nice and tight, as you can see here. Right, now the moment you finish cutting off your GP, we have to condense our GP to make sure that we have a nice tight fit coronally of that GP. All right, there we go. We have to really push it down in the packet nice and tight. And one thing that you must not worry about is the GP moving through the apex, because at this stage we expect the GP to have a nice apical stop, right? So that apical stop will prevent the GP from going through the apex. Now, ladies and gentlemen, that was my few minutes on how to demonstrating the single cone obturation technique, because the next thing that follows from here will then be cleaning of the pulp space and then initiate core buildup. Thank you, ladies and gentlemen. God bless you and good night.